Hello, I'm Janine Kakmar with PHTV Channel 4 Palos Heights, and we're here with our show, Healthcare Experts in Your Corner. On this show, we talk with a healthcare provider in our community so you can learn about the different resources that are here in Palos Heights. And today we have with us Andrea Quinn. She's a clinical coordinator in the Department of Pharmacy at Palos Hospital. So thanks for being with us, Andrea.
Thank you for having me.
Yeah, Andrea, we're going to talk about something interesting today. So a problem that's been coming about the proper use of antibiotics and the growing problem of the antibiotic resistance. But before we get to that, why don't you tell us a little bit about what your work? What does a clinical coordinator do?
A clinical coordinator is, my position at the hospital is actually someone who takes care of hospitalized inpatients, so people that are in the hospital and admitted to the hospital and staying overnight in order to have treatment for whatever is causing problems at the time. And we work with our doctors and our nurses to help ensure the best use of medications and the proper use of medications to make sure we get the best benefit and the least amount of side effects for any of our patients.
Crucial.
Yeah, I'm a doctor of pharmacy, and in my role I'm a little bit more of a manager type.
Okay.
But I work with all of my healthcare teams and my pharmacy team to help provide the best care that we can to our patients for their medicines that they're on.
Okay, all right. So we've been hearing in recent years about the antibiotic resistance bacteria. Okay, what is that? Can you explain what that is, first of all?
Absolutely. Antibiotic resistance or bacteria that have been resistant to antibiotics have been around for a long time. Actually, when penicillin was first invented, Alexander Fleming said if we don't use antibiotics wisely, we're going to have less agents available down the road.
Really? So back then they were aware of that?
Back then they were already forward thinkers and realizing we have something that's good to treat bacteria, but if we don't use it wisely, we can run into problems. And here we are now in 2018, and we're having many antibiotics that are no longer working to cover some of the bacteria.
And how does that work? I mean, can you explain a little bit how that actually works?
Absolutely. What it means to have antibiotic resistant is that the antibiotics that we used to use to treat bacteria are no longer effective for that bacteria.
So bacteria has evolved into something to resist that then?
Absolutely. The antibiotics become much smarter, and they can outsmart the antibiotics. Maybe they change the way their cell wall is, or they have the ability to pump it out of their cells. So all big fancy terms, but basically they can start adapting, and those antibiotics that we're using to try and treat infections no longer work as well.
Okay, so why don't we just make more?
The scientists are in the lab.
The
scientists are in the labs actually doing that now. For about the past 15 years, we've had almost a desert of antibiotics. There weren't new ones coming out on the market, but over the past year and a half to 2 years, there's new antibiotics that are coming out. Some are revamped versions of our current antibiotics, maybe using things in combination or adding a different little booster with it, and some are brand new antibiotics that work in a way that we've never seen before.
It's kind of a tricky thing because, I mean, how do you know when someone's ill, like if you're ill and you're getting an antibiotic, how do you know if it's the one that's not going to work on you? Is that, am I making sense? Yeah.
I think the most important thing to remember is that every time we're sick, if we've got a runny nose or a cough or a cold or the flu-like symptoms, even the sinus pain or an earache pain, many of those symptoms are caused by viruses. And antibiotics do not work against a virus. So if you have an infection and you're coming in with a runny nose and you take an antibiotic, you may think that that antibiotic's working, but it's really not. And all that antibiotic is doing is potentially causing more harm down the road because it's killing off the other bacteria,
the good bacteria,
and it can allow growth of what's known as resistant bacteria. And many times we in healthcare, it's very hard for us because we want to make sure we have conversations with our patients to say sometimes all you need is time. If you've got the runny nose, if you've got the cough and the cold, it's a virus and it will run its course. Drink your hot tea and your chicken soup, Grandma wasn't that far off.
Yeah.
And then see how you feel. And then sometimes down the road, an infection due to a bacteria can develop, and that's when an antibiotic would be needed.
So it's tricky trying to explain that to someone who's not feeling well. They want to get better.
Right.
Nobody likes to be sick.
Right.
But, you know, how do they know whether it's a bacteria they have, you know, or is it a virus, you know, viral thing or a bacterial thing, you know?
That is the biggest challenge, and we as patients, we feel better when we go see our doctor sometimes and we get the prescription because we feel that we're being listened to and now we have something to make us feel better. And many doctors nowadays are having the conversations with their patients and saying, you know, I think it's a virus. Let's watch and see how you are over the next day or two, and then they'll determine whether or not an antibiotic is needed.
Okay, well so how do you then work with the patients or with the care providers at the hospital for this, in addressing this?
That's the challenging part in the hospital because many times our patients who are admitted to the hospital have some type of bacterial infection, and we want to make sure that we're using the right antibiotic for those patients. And we have conversations with our physicians and our nurses and everyone involved in the healthcare team to make sure that we're doing what's best for the patient. Antibiotics are good, and they just need to be used in the right situation.
How do you know when a antibiotic is actually working or not working? Is it you just have to wait and see, or how does that work?
We can do some science-y things for our patients and take what's known as cultures. If you've ever had strep throat, the doctor may come and take a swab down your throat and they'll send it off to the microbiology lab and then they'll see if something grows. If a bacteria grows, then they're going to say it's a bacterial infection and you receive the appropriate course for that. We do the same thing in patients with pneumonia or patients that may have urinary tract infections or bloodstream infections. We'll do what's known as cultures and see if something grows out, and then hopefully we'll select the best antibiotic to treat that.
And if you don't, I mean, there's many different types you're saying now?
With antibiotics?
Many different types of antibiotics being made now?
They're still around the same. There's newer ones coming on the market that target these really resistant bacteria, but we kind of go to our gold standards.
Okay. You know, sometimes a doctor will not prescribe an antibiotic even though I'm feeling sick. And you're saying, why is that? Are you saying that is that because he wants to be sure?
More than likely the doctor's thinking that whatever is causing your problems right now, the runny nose, the fever, the cough, may be related to a virus, and antibiotics will not work for viruses. They only work for bacteria.
So you have to check on that.
Correct.
So going to the doctor and getting an antibiotic is not always the right thing to do right away.
Correct. Correct. There are use for antibiotics, and again, the doctor is going to go look at every detail about the patient and make a clinical assessment or clinical judgment as to what he or she thinks is causing the problem. And if he or she thinks that it's a bacteria, then by all means an antibiotic is what is prescribed, and that's the best course. But if it's something if it's more of a virus, even like the flu, it's just rest.
Wow. What is it? Is there anything that, you know, we as the public or as a good patient can do, or someone who's not even a patient yet, or some way to keep ourselves healthy? Are there things that we can do?
Absolutely. The number one infection prevention is actually hand washing. Good hand washing will help prevent help decrease the chance of you getting an infection for things.
I heard, tell me if this is right, I mean, like a lot of times when I wash my hands, just like wash in real quick and clean them. But I heard that you're supposed to scrub your hands to the length of the song "Happy Birthday." Is that true?
That's what we've heard as well.
Okay.
So, and it depends if you sing it quickly or slowly.
Right.
But usually, if you can sing "Happy Birthday" twice to yourself,
that's how long you should be washing your hands. Okay, so
with soap and water.
That? Sing "Happy Birthday" to yourself and wash your hands.
Correct.
Right.
And the other thing that patients can do is keep up to date with your vaccines. Make sure you get your flu shot. Make sure you get your pneumonia shot if you're of the age group to do that. And all of the other vaccines that you need for your age group. And that's something you can talk about with your doctor or your pharmacist at any of the retail pharmacies like Walgreens or CVS.
Now I know certain people whose names I won't mention, they have like old pills that they haven't finished laying around the house, and sometimes they feel like, oh, I should just take this. Is that not, are you going to tell them not to do that?
Absolutely. Never take leftover antibiotics. And the reason you don't want to do it is there are actually a few reasons you don't want to do that. The first one is that the antibiotics may not be working anymore and they can break down, and the breakdown of the antibiotics can actually make you sick. So you want to be careful with that. The second thing is if you're using antibiotics for something that you don't need to take an antibiotic for, you're now killing some of that good bacteria and allowing that resistant bacteria to grow. And the third thing is that antibiotic that you might be taking might not even work with what you have. So the safest thing to do is to dispose of old antibiotics properly. You can take them to any of your retail pharmacies. Many of them have the drop box where you can put prescriptions.
Is that right? Does Palos Hospital have that?
Palos Hospital does not, but this
Okay.
would be the retail pharmacies.
Okay, I do know that the City Hall here, Palos Heights City Hall, does have a drop box, pill drop box. It's right when you walk in the door. Actually, the library is having a pill drop off on September 29th as well. So just pills only, no salves or needles or anything like that. But that's something to gather up those pill bottles and get rid of them safely, right? I think they incinerate them, I believe.
Yes,
Yeah.
yes, so they don't go into the water supply.
That's correct. What about, I was looking on the website for the Palos Hospital and I saw something about the antibiotic stewardship program. What is that about?
Antibiotic stewardship is basically making a promise that we're going to use antibiotics wisely.
Okay.
We as a healthcare organization and we at Palos Health feel that it's extremely important to make sure that we're using antibiotics in the best way possible to make sure that they're around for years to come. And we work with our doctors and our physicians and our nurses and everyone involved in the healthcare teams to make sure that we are using them for the right indications, for the right amount of time, at the right dose to treat the infections. And we develop protocols and educational pieces to make sure that everybody knows how we should be using them.
You just said educational pieces. I bet it takes a lot of, educating, not only the professional staff, but even the patients themselves, because, they read a lot of, or hear things, or so their neighbor told them something about this new treatment or whatever, and it's probably a lot of education needs to be done to let people know what's the correct thing to do. And
it does, and all the education comes along from what's known as evidence-based medicine, so the experts that are out there publishing the studies. And the challenge that we have is making sure that we're putting it out in a way that it's understood by all and accepted by all.
Wow.
Everybody's a different learner.
Yeah.
So making sure that you're getting it out the right way.
Right, right. Is there anything else you'd like to share with with us? Anywhere else we could find resources for this? Is there anything on your website?
Palos Health we put out in a Perspective magazine a few years ago some information on antimicrobial stewardship. The CDC, or the Center for Disease Control, actually has wonderful resources about antimicrobial use or antibiotic use, including some very interesting statistics.
So the CDC stands for?
Center for Disease Control.
Okay. And so that's a .org?
Yeah, www.cdc.org.
Okay. So they have some helpful information for the public.
Yes.
Okay.
The other thing is you can talk to your doctors, you can talk to your pharmacists, and they will have information as well for you.
Wow. Well, Andrea, thank you so much for being here with us today. Thanks for sharing your information, your knowledge about, and the program of the antibiotic stewardship program and everything about it. I feel like I've learned a lot, and I hope I don't get sick. I hope none of you get sick. But if you do, take note to what Andrea just shared with you, and take note of some of the resources she shared as well. So thanks again for being here with us today, Andrea. Thank you for watching. We'll see you next time.
Thank you.